Hello, everyone. Hello, Dr. Ashish. How are you today?
Good afternoon from the UK. I know you have good morning there.
Yeah, we have like a good day today, which is good after a snowfall
Oh, okay,
in
right.
spring, So the weather's changing finally. We're super excited. So excited to have you. Thank you for joining us. Hello, everyone. Welcome to another Saturday expert series episode. Today, our topic is conception, how to conceive naturally. And this is the Canadian Week for Infertility Awareness. That is why I decided that this is such an important topic that needs to be discussed. And we have a very special guest. Our specialist is straight from UK. Dr. Ashish Paul is a doctor of Ayurvedic medicine. She's also a practitioner of Western herbal medicine. So she has MSc in herbal medicine. She's joining straight from London, UK, and she specializes in fertility, which is really fantastic. So it's amazing to see you here.
Thank
Thank
you.
you so much.
Glad to be here.
Yeah. So, hi, Ajay. Hello, Diksha. Thanks for watching this. If you have any questions for us, please post them in the comments. If you are watching this live, say a quick hi. If you watch this as a replay, put a hashtag as a replay. Any point of time, if you have any questions for me, please let me know. And if you have questions for Dr. Ashish, let us know. And all our information is in the write up above the video. So that's where you can find us as well. So let's get started.
Yeah, let's get
My first question that I would love to ask you is, we talk about fertility in a very different aspect when it comes to Ayurvedic medicine, right? So, and the understanding of fertility in Western world is very different. So, can you talk to us a little bit about the Ayurvedic perspective and why is it important to develop, that specific perspective when dealing with infertility?
Yeah. So I think Ayurveda is obviously unique and it has this specific thing which it says that everybody is unique, which comes from the concept of doshas. So doshas means your personality. How are you as a person? So whether you're Vata, Pitta, Kapha, those are the three Ayurvedic personalities. We also have personality types in modern psychology. We have personality types. There are Jungian types. There is Briggs, method with which you can see whether you are extrovert, introvert. It comes from who you are as a person. How does your mind work? How does your body work? How do you digest food? All of those little things make your fertility, because as you know that in the sequence of our body tissues, fertility is the last body tissue that is made from all the dhatus, which means that you have to have all the rest of the body working really well for fertility to work well. And then the last one is immunity. And so for immunity, we can't pinpoint, the whole system has to work well with your mind. So that's the really specific and unique point from Ayurvedic perspective, which is completely not discussed, or they don't even know about this in modern medicine. It is only, okay, if you don't have the good eggs, let's just give you medicine to produce lots of eggs. So no health is not, it's not holistic enough. So Ayurvedic medicine is holistic. It takes mind, body, spirit into perspective, takes your circumstances into perspective, your diet into perspective, which is not done with the modern medicine.
Mhm. And this is really important, because there's not just one fix where you're either taking the support of, medications to, for even ovulation, right? Which is very common. Like we check ovulation here, but you're not looking at the dietary piece. So, as you mentioned, that what you eat has to go through levels or layers to form the seventh layer of reproductive tissue. And if you're not forming that, that itself is going to create a lot of challenges for you, right? So again, when we talk about Ayurveda, we talk about cleansing, we talk about preparation for the conception rather than thinking about the conception, because there's a specific diet, there's a specific cleansing procedure prior to conception, and then there's a very specific diet throughout fertility as well. So can you talk a little bit more about that too?
Absolutely. We are what we eat and we are what we can digest. So many people are into this mindset, okay, I've got the best food on the planet, I've got the best organic food that I can buy. But if your digestion is not working well, you are not getting the best nutrition out of it. Also, what we are seeing is, from modern perspective, even when people are aware and using a lot of supplements and diet, uh, they may not be using it at the right time, the right quantity, um, the right food for their constitution, and they may not be able to digest a particular food. So modern medicine doesn't look at that, whereas Ayurveda talks about how is your diet for you as a person, and then what can we do with, and you may not need this complicated stuff, you may only need something very, very simple. Like, I recommend a lot of ghee intake, because we know that ghee is one of the best fertility, enhances fertility really well. But it has to be, again, suitable to the person, how much of a particular food you can eat. So you're right, it is about learning that what foods are suitable for me, overall, to my personality, within that range, which ones are the ones which are good for fertility. Yeah.
Mhm.
And then also, when certain foods may not be as good for your personality, then how can we take it so that we don't vitiate our doshas, so that we don't irritate our doshas and don't get hyper in a particular dosha. Yeah. So that's the beauty. And I do extensive work with diet of a person, talking to them about how can they eat it. So I like to give a lot of personalized and practical solutions. It's no good giving somebody idealistic advice and then they don't use it.
Yeah.
It's of no use for them. So yeah, it is that whatever you are eating, it has to be suitable to your constitution. It has to be suitable you have to eat it at the right time. You have to eat in right quantity. You have to eat it with the right combination of foods. All of that eventually is going to make your fertility.
Are there, as you mentioned, ghee, which is generally good for fertility, right? So we have never seen ghee having any bad effect unless you have a lot of toxicity where you're not digesting or a really poor digestion. But ghee is one of those things which is generally suitable to everyone. Are
Yeah.
there any other such foods that promote fertility that are generally suitable to everyone? And the second part to the same question is, are there certain foods which are generally bad for fertility across everything?
Yeah. Yeah. So I'll tell you the bad ones overall would be the foods that enhances the heat in the body. Anything that is increasing the heat, lots of chilies, lots of spices, because we want to create a nurturing environment for the fertility. So we want more kapha part to be involved. Of course, it's more complicated. We are talking about generalized scenario
Yeah,
here.
yeah.
Generally speaking, you want to reduce the pitta, the heat. So spices would be, you need to reduce your spice intake when you're trying to conceive. It goes for both men and women, because sperms also don't like the heat. They would rather be cooler. The good foods are, ghee is one of them. And of course, it has to be digested well. That's why we give pipali, or we give black pepper before we start. Yeah. Then we have lots of nuts and seeds, all kinds of nuts and seeds, as long as you're not allergic to nuts. I also recommend a lot of nut oils. So eat nuts and seeds, drizzle the nut oils on your salads, in your food, in your curries, whatever you are eating. Maybe cook with them, the ones that you can cook with. Avocado is one of my favorite fruits or foods, because it's protein. It has a copious amount of fat that we need to make good hormones. So these are generally good foods for the body. Fish is another one, and oily fish. So all, two, three types of main oily fish that we have. If you can have it 2, 3 times a week. So these are overall generally really good foods for fertility. But of course, the only tricky bit is that how much, when, and all of those has to be looked at with a practitioner.
Mhm. And what about anything like one point I really liked is, anything that increases the pitta has to be avoided. And in here, the biggest trend that I see is for fermented foods, right? And I can't talk enough. Like, I think this is what I've been talking for the past entire month in most my lives. I'm like, you're drinking tons of kombucha, this is like typical holistic person who wants to go on this holistic health journey, right? So they'll start drinking tons of kefir, kombucha, they'll start adding lots of yogurt into the diet because of getting all that probiotics. But this is what's increasing the pitta as well, right? So again, stay away from too much sour foods, right?
Yes,
That will create acidity in the tissues. Any thoughts on pomegranate? Because that's one of my favorite foods when it comes to fertility and
I
conception.
know.
So, what are your thoughts about it? Or any fruits that you recommend your clients to add in their diet?
I do. So pomegranate is also another one that I ask people to either eat or have fresh pomegranate juice. Pineapple is another one, which is one of my favorite ones to have because it has got all those good enzymes which are required. And then another one is papaya that I recommend. Papaya is very cooling and calming for the gut. So it works really well when you're trying to regulate periods as well, because I recommend it as a specific protocol when we are trying to do natural fertility, in the beginning. So these are some of the favorite ones. But again, as you mentioned about yogurt or anything else, it's you don't have to drink buckets of pomegranate juice. It's only 100 ml of pomegranate juice is plenty. Your body can only take up that much nutrition, especially vitamin C, all B and C vitamins. They're water soluble, they cannot be stored in the body. They're going to go out with your urine. And so if you are drinking lots and lots of any of the juices, you are really putting an overload on your kidneys rather to get that water out of your system. So yeah, it's the amount has to be reasonable. I think people are just drinking mindlessly and drinking too much of the
Yeah.
juices.
Yeah, yeah, no, well said. Too much of a good thing can also be bad, right? If it's too much. So,
And it will
yeah,
reduce your digestive fire if you're drinking that much juice. It's
yeah,
so cold, right?
yeah.
So the moment you drink a big gulp of pomegranate juice, it's like the inside has frozen. It's so cooling, especially if you live in the West here, which is a cold country. Then you have to, small amount is what I recommend.
Okay, no, that's really good. And how soon should people start preparing their body for conception, right? Is it good to start 6 months before, a month before, 3 months before? So, what is your take on how much time do you need to prepare for a healthy conception?
Yeah, I normally say give yourself 1 year for natural fertility. I'm talking about when you tried for a year or so, nothing is happening. Then start looking into natural medicine. Start looking at herbs and therapies and diet and lifestyle. All of that. Give yourself 1 year because your body tissues are going to take time to adjust to new nutrition, and whatever nutrition you are giving, even if you give intense amount of pomegranate juice or anything, your body still is going to take its time to absorb and digest that nutrition. So that's why we need that much time. And also because you're regulating your hormones, you're regulating your ovulation as well. You need to know how and when you're ovulating. So that takes a bit of time. We know from medical point of view that it takes 3 months for sperms to be made, for eggs to be made, from follicle to, yeah. So we need that much time at least. But because people are more busier, they have got a lot of other things going on in their life. So rather than adding that stress of last minute thing, give yourself good year to turn around your habits, slowly look at things, and then target it for a year and ahead in time.
Okay. So that's really, a great suggestion. I'm gonna say a quick hi to Diksha is here, Pauline is here. Hello. Hi Poonam. Hi Hanka. I'm gonna ask your question at the end because it will divert us from the topic, but I'll ask the question at the very end for sure. Thank you, Ramdev. Thank you all for watching. If you have questions related to fertility, please post them in the comments here, and we will answer your questions after we've done our discussion. Now, fertility wise, you mentioned that at least spend a year trying, before you start seeking any other support. But even for certain people, when they want to make sure everything's perfect, they try to seek this cleansing help with Ayurveda or want to go on a certain cleanse prior to fertility.
Yeah.
Or rather, my question is, what should you do like what are the benefits of planning a conception as opposed to conceiving and then seeking support, right,
Mm.
to throughout the pregnancy, or a planned conception where right from the beginning you're like, okay, I'm planning for a fertility next year and I'm going to take this year to really strengthen my body. So what have you seen any difference between the two when it comes to pregnancy and the child?
Oh, absolutely, absolutely. We are talking about, conceiving good pregnancy. We are talking about maternal health. We are talking about conceiving kids with better genes and better quality of their health as well. So for that, we need to prepare. Men and women both need to prepare because embryo takes genetic material from both the parents. So in Ayurveda, and I know that there is this concept of Garbh Sanskar. The moment you have this thought in your mind that perhaps next year or in 2 years' time, we would like to start our family, we would like to have a baby. So you first started from here, from inside. You need to work at things between you two as partners. Talk about things. How does this make you both, it's a joint effort. It takes a lot of resources to bring up a family. So are you both ready? Because that's the first question that I ask my clients. Why would you like to have a child? It's not because so and so is having a kid and you just want to be the next one, or so and so in your family your brother had a kid and that's why you would like to have a partner for that. No. What is your reason? Have you inquired deeper enough for you to feel that, to bring that soul into this life? Yeah. So that's where it starts, from inside out. And that's going to take some time for you to discuss things. Maybe your partner doesn't want to have kids right now, or maybe your finances are not in place right now. To I take a lot of, it's a very practical approach. It's not just only, yes, it's a soul and it brings its own destiny. I don't like that idea, right? So preparing preparation, I always give this example, maybe a stark example here, but you will dig a well before there is a fire, right? You don't start digging a well when there is a fire already. So you want to prepare much in advance, because all those changes are going to take time. Sometimes there may be mental issues that will take some time to resolve. And this is when you don't even know whether you're going to be successful or not. You don't know whether, if in years time you're going to start having non-protected sex. You don't know how long it's going to take you to conceive. And we know that overall fertility is reducing for both men and women in the world, more so for men than for women. But overall, it is going downhill. So we need to prepare. And that's my key. That's the key of Ayurvedic education and wisdom, is prepare, prepare, prepare. You can never over prepare. You can give yourself enough time to do panchkarma. I recommend panchkarma. Anybody who's starting, go for panchkarma. If you have 1 year in between, then do that and spend time to prepare now. Everything that you can do around that decision, and then jump into it, and don't just go straight head into it and then think, okay, now what do I do?
What about people who don't have much time on their hands? Like in the Western world, you're trying to make a life, and I know you live in London, which is one of the busiest cities, and you're trying to get your life in order. You're trying to get your finances in order, before you plan for a baby, and you're 35 or 40 before you know it, right? And as we all know that, the chances of conception are going to decrease with every decade of your life. Like the thing that we were taught in school was an elderly primary is she's 30 and she's trying, but here we see 40. We also see people in their 50s trying to conceive for the first time, right? So that is also kind of the norm here in metro cities or bigger cities. So when people don't have much time on their hand, are there any specific suggestions you would give them?
We start with wherever people are, if they want to take that, because I work with a lot of IVF clients, and one thing they don't have is time.
Time, yeah.
They are already on IVF protocol and all of that, or that your age is such where time is just ticking away. So in that case, I go full head on with intense Ayurvedic remedies, Ayurvedic therapies. I have a special program for that, where I've taken a lot of Panchkarma wisdom and I use that to enhance their fertility. Whatever can be done, I give them at least 3 months, or I
Okay.
ask of them at least 3 months when they're working with me. And I normally then, we speak to the IVF consultants to change their, so that appointment can be slightly delayed. If we can do some work in between, if they can have some therapy work, and they can have intense doses of remedies and Ayurvedic medicine, then that's what I like to do with them when they don't have the time. But we need a little bit of time, because we know that if you are not prepared and you go into any method, it then doesn't work. And rather, there is more heartbreak at that point. Or that you do conceive, but you don't retain it for long enough or for full pregnancy. There are a lot of people like that who miscarry again and again. So we want to have successful pregnancy, which stays full time. So for that, you need at least 3 months minimum. That's the minimum that we're going to require.
We've talked about a fertility diet, but what about a mindset when it comes to fertility? Right? So what's your take on the fertility mindset? Is it different? Is it something special, or what is a fertility mindset?
Oh, fertility mindset. Tell me about that. I work with NLP, which is neuro linguistic programming, and I'm trained hypnotist. So I work with that, and I use a lot of meditation techniques and yoga nidra to help them to get into their mind. Because most of the time, people do not realize that what their mindset is, how their perspective is on life, it's affecting their fertility too. Um, and that may be, and I talk about this with another friend, a hypnotherapist of mine, and we are doing this Clubhouse collaboration where we talk about this main thing is mindset. And when a little thought, maybe you were very young, this has happened to one of my patients. She saw her mom had one or two miscarriages, and she had the thought in her head that maybe I'll never be able to conceive. Why? Because she saw her mom going through that pain. And guess what? She was having fertility issues because she had that thought going on and on and on in her head for all that many years, for 30 years. So most of the people are not aware because they don't know. It's a very subconscious thing. People are not even aware whether they think positively or they think negatively. Yeah. So that's where I do a lot of work with that. And I think anybody who's going for fertility treatments or want to start their family, they should go and have a session of counseling, psychotherapist session, or if you have a mentor or person like myself who does it together with holistic therapies, the best, because you can look at what is it internally that is affecting. Yeah. And what is affecting your journey going into it, because fertility journey, when it doesn't happen, it's long, it's tiring, it's very lonely for women, especially. So they should be the ones who should look at everything. Am I thinking in the right way? Am I fully prepared mentally? Do I really want to do this? Am I prepared to do this? All those questions. But they will only ask that when they will have some kind of professional help, because normally we don't know it ourselves unless we are trained professionals.
So that's a really good insight, what are the fertility myths? Because there's so much, this is such a vast topic, and there are a lot of myths about fertility. So what are your top three myths about fertility that you would like to burst?
Oh my God. Okay. Top three fertility myths. Um, the top one is, I would say, and I'm a practitioner, so I'm biased, is that would natural medicine or herbs will work with fertility? Do they work for fertility? And my answer is yes, they work for fertility, and they work very well on their own or with IVF if you want to go for that. So that's one of them. Another fertility myth is, yeah, people think that, having unprotected sex, that is enough to conceive. Yeah. Um, it's not true. The chances of natural pregnancy in normal couple, when you're not using any contraception, is only 20, there's only 25% probability,
Mhm.
right? So which is really small window. So just thinking that, okay, we are not using any contraception, then it should just straight away happen. And also to think that, okay, we are having lots of sex and it should happen is not true. Yeah.
Mhm.
So it has to be at the particular time of the month when you ovulate. That's the time. And it's a very, very narrow window. So that's the second myth. What's the third myth? What can you think of? Do you have a myth? Because I can't think of another one.
The one thing is, that I have heard is if you have PCOS, then you're doomed. You're never going to conceive. But like we've both experienced that our clients, even with PCOS, when you correct the situation, do conceive naturally
Yeah.
without IVF as well. So that's the one myth that, I have seen. So what's your take on PCOS?
I agree. So PCOS or endometriosis, when you have any of that kind of diagnosis from the modern medicine, and many times patients are told, "Oh, you have endometriosis, so
Yeah.
you'll be lucky if you ever get pregnant." I mean,
Yeah.
doctors tell this to their
Yeah.
patients, right? And it's not true. You can have, and we know that 25% of infertility is unexplained, where there is everything is fine, it's still not happening.
Yeah.
So in PCOS or in endometriosis, you can conceive very well. You can have the, in a way, I mean, I don't know if it's the right thing to say, you can have a really bad scenario case of PCOS. You
Yeah.
can still conceive. Body
Yeah.
works amazingly when it has some support of herbs and natural therapies and stuff. And you don't know until you have done this. So
Yeah.
that myth is definitely not correct.
Yeah.
It's a myth.
Yeah, so we'll start taking some questions now.
Yeah.
And we've had a really wonderful discussion. If you're watching this live, I can see quite a few of you are tuned in. So if you're watching this live, please post your questions, in the comment section, and we would love to answer those questions. So Pauline is asking a question: when do our eggs start drying up? So she talks about as we age, we have less eggs. So can you explain this a little bit?
Yeah, sure. I think, yeah, that's a really good question. And hi, Pauline. So, eggs don't start drying up at any age. What happens is that your eggs start to shrink in size as we are aging, because age wise, body is giving this signal that you are not getting pregnant, you're not getting ready for having a baby. So, slowly that eggs, the follicle size start to reduce as we age. They never dry up fully, and we can always give them medicines and therapies to excite them and to bring out the size better to release. Yeah. I always say for pregnancy, you need one egg and one sperm. And even with, because many a times people ask, oh, I have very low AMH, yeah, which is one of the parameters to check how much egg reserve you have. Okay. So even when you are 40, you may be 45, you may have really low AMH. That still means you have hundreds of egg lying in there. Okay. Because your ovaries at the time of puberty has got 300,000 eggs. Okay. And out of that, you may be releasing one or maximum two eggs every cycle. Okay. So by the time you reach 45, you still have got thousands of eggs left there. Okay. So, yeah, that is probably another myth. But as you age, what happens is this eggs start to become sticky. That's what happens, and they don't release as quickly as they would do when age is younger. And this is to do with aging process of eggs. Like we age, eggs are aging as well. So that's what happens, Pauline. And age is a factor, especially for women, but also for men too, because if they are aging and if sperms are older, then the studies show that miscarriages happen much more, and the pregnancy doesn't sustain because the quality of genetic material is not enough. So yeah, at any age, if you are dedicated and if you use a lot of therapy and herbs, you can get that good quality one egg.
Mhm. So Pauline is asking another question: how do you make them active?
Yeah, that's another lecture or whole thing. But
Yeah.
what I can say is that you can make them active. I have a patient, she's 46, she's pregnant right now, and other patients who are 40 plus, they have used, it's not only herbal medicine they have used, but even with other IVF drugs, and you use herbs alongside, you can make them active. But herbs work really, really well. And what I see work really well is the therapies. Ayurvedic therapies work fantastic. Abhyanga, I do a lot of basti, which is colonic, herbal colonic, and that I see work really well.
Mhm. No, and again, like always working with a practitioner is the number one thing, right? So you can definitely approach Dr. Ashish. If you want more information on this, if you have any other questions, you can also approach me, right? So that's the
Exactly.
one thing, but always start working with a practitioner, because you will, of course, invest into it, but also you want to get the results, right?
Yeah.
On the internet, if you Google, that's the one thing that I see. Again, the question is what herbs would help. So again, in Ayurveda, there's no one answer that I
Yeah.
believe that Dr. Ashish might be able to offer you her insight on this. But when we talk about an Ayurvedic perspective, there is not one pill that's going to fix the same issue in every person. It's a
No.
very generalized approach. We have to start looking at your diet, your lifestyle, your age, all your factors, right?
Yeah.
Your mindset. So like, reaching out to her would be a better option than trying the one herb that either we talk about today, or you Google, and you find so many answers to it. So always working with a practitioner is what I believe is the best option. What are your thoughts on herbs that help?
Yeah. So, Pauline, I would hate to give you a name of a herb, because I always say that do not take generic herbs that you see online and then you might be taking them wrong. You should Google which is the nearest practitioner to you. That's what you should Google and go and see them, because that's where it starts from. They are the ones who can really assess you properly and can give you the right medication. But otherwise, Google as much as you want. As long as you are working with a practitioner and you're supervised, is what we want. There are a lot of herbs you will find online that have been recommended, some of them rightly and some of them wrongly. So yeah, and I think Dr. Mandri has said it very well. So that's my bottom line advice is go and see a practitioner.
Yeah, and see, I'll tell you something, and this is not because we're trying to pitch ourselves. What is happening here is we both have seen enough clients in our practice that have taken the wrong herbs, the wrong supplements, or the wrong form of herbs, right? An example I can give you right now is if you take something as a tincture, which is more of an alcohol extract, right?
Yeah,
And if you have this high pitta already in the body, or if you have this high heat in the body, any alcoholic tincture herb is going to increase your heat, which you don't want, right? So
exactly.
that is the reason why it has to be customized to you. So that is, we're trying to make sure you stay safe and you don't take anything generic. And again, Ayurvedic herbs are not supplements. They are not like you can grab it on the counter. The same with shatavari, which is very popular today,
Yeah,
but
yeah.
it will not work if, in so many conditions, even though it works for so many amazing conditions, in certain conditions, it might not work for you. So that's, the answer.
That's
Now, Diksha has a question that she says that is it true that thyroid affects fertility and how?
Yeah, that is true. Thyroid affects fertility. Thyroid affects hormones, basically. So if you have underactive or overactive thyroid, either way, they both can affect your fertility. Will hamper with your hormones, either make them too fast or too slow, and then you will have difficulty in conceiving. Now, thyroid issue comes from digestion. You need to look at how balanced your lifestyle is, because thyroid is the gland which balances your life. It balances your digestive system and the digestive enzymes. So if your digestive system is working accordingly or working too slow, that's when you generally have this issue with thyroid. But we do see a lot of thyroid issues. For example, in PCOS, thyroid is quite a number of times is affected. Yeah, because it makes sense. In PCOS, there is excessive weight, body is slower, and there is we have a lot of cyst as well, which also comes from the slow metabolism as well. Yeah, because kapha is just getting in your system. So thyroid does affect, but you need to look at overall your systemic health, and it can be very well managed or treated with herbs.
Yeah, that's a really, good thing. And again, that's another myth. I have thyroid and I won't be able to conceive forever. So again, taking the time to bust that myth. Another interesting question we have is what can we do to increase endometrium thickness?
Yeah. So, what can we do to increase? I mean, that I have seen results with that. Uh, One big thing for that is the fat. So, good quality fat. And you also need to look at what kind of oils do you use in your cooking. So, if you're using any refined oil, get rid of any refined oil in your homes. Refined oil means the oil that has been boiled before, and it is not good for our body. So you want virgin oils of any kind. And I'm a huge fan of ghee. I know that it is not vegan, it comes from animals. So I'm very well aware of that. But if you want to increase endometrium thickness, you need to pump up your fat. Yeah. At the same time, if you are somebody where weight is an issue, then you need to increase the fat and then increase the exercise. Yeah. So that you are not piling that fat on. But fat is what works best for endometrial thickness.
Okay, that's a really, like, I'm not gonna say that's a really good answer for everyone because I know you're giving amazing answers, and you have to correct your diet as well. Like one thing is you every single day. Even though we talk about Ayurvedic prakrutis, we live in a Vata deranged world. A world that makes us Vata deranged. So always balancing, managing your Vata dosh, any aggravations if you start noticing, you have to kind of check it right there. Now, Hanka is asking another interesting question that can you please talk about the antiphospholipid syndrome, which is the genetic predisposition of blood clots related to miscarriages in the first trimester. What's your take on this, and have you had any successes with this condition, Dr. Ashish?
I haven't seen anybody with this particular condition. I have seen patients with miscarriages and recurrent miscarriages for other reasons. But one thing I would like to say for this particular condition, you take, because it's a genetic condition, so you take whatever modern medical doctors will give you. So you're probably on a lot of steroids and clotting medication that you're taking. Um, no, clots are happening, or what was the question again? Sorry.
Yeah. So there is the blood gets thicker and starts clotting. So that's
You
the
might be
reason.
on
Yeah,
blood
yeah,
thinners. Yeah.
yeah, yeah,
So even with that, you can take herbs. But you definitely, for something like this, you want to be with a practitioner. You don't
yeah,
want to use anything on your own. But I always say you can take herbal medicine, whatever the scenario. You can do a lot of therapy work with this because you're trying to thin the blood. So, which will help if you're having a lot of abhyanga and massages, because I do a lot of deeper work with massage. So, the more blood flow there is, the more flow there is overall in the body, that will help with lesser blood clots. Yeah.
yeah.
So use natural medicine and you can combine both the medicines together.
Yeah. And that's, one my aspect on the same condition is, it has to do more with ama or as, kapha formation because that stickiness is happening overall in the body, right? So even though you're taking warfarin for it, again, see, you're thinning the blood, but
Mm.
you also have to focus on the quality of the egg and the sperm.
Yeah.
So that is where if you go for all the advices that Dr. Ashish is giving, you go for Abhyanga, you really plan well. You are making sure that the quality of that one egg that you require is fantastic. That one sperm that you require is fantastic.
Yeah.
Genetic disorders have their limitations. I won't say no, but then you have to make everything what you can control the best, like your diet, your lifestyle, and work with a practitioner who can guide you, right? So feel free to reach out to Dr. Ashish. You can carry more conversation as well as to how she can support you for
Yeah.
sure. um, is all big frame and low metabolism kapha dosha?
All big frame and low metabolism. Answer is yes.
Yeah,
Yeah.
so Yeah, so so Abir heard one of the talks I was giving yesterday in another group. We were discussing about, weight gain and how kapha can impact it. So if you have a bigger frame of the body, and you will have a slightly lower metabolism, right? And that's why you're prone to weight gain. And this is what also can create conditions like PCOS. And that's where a lot of therapies that Dr. Ashish was talking about, even specific herbs can work really well,
Yeah.
right? So again, the one thing with kapha is also you're extremely fertile. So unless you create this armor, so you don't have to worry that, oh, I have a big frame and I have a lower metabolism. Actually, of all the three doshas, the kapha are the most fertile ones.
Fertile,
So
that's right.
yeah, so as long as you're in balance, right?
Yeah,
If you go out of balance, then you might struggle with infertility. But
yeah,
if you are naturally, balancing your doshas, if you have a good diet, kaphas are the most fertile of all the three doshas.
yeah.
What is PCOS?
Right. So PCOS, it's that's a big answer, but I'll tell you very, very in short words is polycystic ovarian syndrome, where you have cysts in your ovaries, and cysts are fluid-filled spaces or fluid-filled follicles that are sitting in your ovaries, which means that you don't release an egg every month. So you may not be ovulating, which means you may have issues to conceive. And now it is linked with high testosterone levels, and it is also linked with high insulin resistance. So it has become an overall metabolic condition. You may be also diabetic or pre-diabetic when you are PCOS, which is linked with your digestion. So that's the short answer for polycystic ovarian syndrome.
So, any other questions, you can post it here. Now, my question is, Dr. Ashish, where can people find you and what can somebody expect when they start working with you?
Yeah, you can find me. Ashish Veda is my name that I go by. You can find me online on all the platforms, Facebook, Instagram. I do a lot of work to do with Ashish Veda Fertility. And we have a website, ashishveda.uk. And another one, which is not live yet, will be ashishvedafertility.uk. So specifically for fertility. And what was the other question?
What's the process of working with
Yes.
you?
Yeah. So it starts from a consultation. I normally have mentoring programs that I work with. You can take online mentoring programs. So you could be any part of the world, and I will guide you going through your fertility journey. You can take that as part of a group program or one on one. And I have a bigger program, which I call Ananda program, that works for 3 months, where I do a lot of therapy work with clients one on one. And I give, all Ayurvedic herbs, and I do use Western herbs as well. And I then do a lot of mindset work with patients, give them yoga exercises and things to do at home themselves. So, yeah, that's where it starts.
Yeah, so I have posted, oh, sorry, I pressed the wrong thing. So I've posted the link right here. So it's in the comments on Facebook as well as, on YouTube. So here is the direct link to the website for, Dr. Ashish, and you can check out the website and you'll find more information about her. We have two more questions. I'll take Hanka's question first because I clicked on it. So how to decrease estrogen dominance, another big topic, and increase progesterone?
Yeah. So progesterone is overall more linked with increasing the kapha in your body, because that is what is going to sustain pregnancy. What you want to do is increase good quality fat in the what we call the kind of after ovulation period, when the progesterone starts to rise up. That's when you want to eat those good quality fats if you're trying to conceive. Yeah. Estrogen dominance, we have herbs which can reduce estrogen dominance, and that is a bit more specific that you have to use. But if you increase progesterone, and sometimes, the way herbs work is they balance them out. They don't necessarily work on one single thing separately. So if you are taking a particular herb and doing maybe some therapy work, then it's going to balance it out itself. Yeah, rather than just working on estrogen dominance. But we have specific herbs that can work on it. But to increase progesterone, the thing is to increase good quality fat.
Okay,
I
so
love fats for fertility.
ghee all the way.
Yeah.
Ghee. Another question by Pauline is, can you get pregnant or do you have to be put on diabetic meds? I'm thinking this is in response to the PCOS question.
So you can be on anti-diabetic medicines, and you can still get pregnant. You can also use Ayurvedic anti-diabetic herbs at the same time as well. I have a patient right now. She's diabetic, and she was pregnant, but now she's going through ectopic pregnancy. So she was using Ayurvedic herbs, and now she's using modern medicine to reduce her diabetes. But you can get pregnant even on anti-diabetic medicines. Yeah.
Okay. So thank you so much. Any other? Oh, okay. We are having lots of questions. I'm okay if you have the time, you know.
Yeah.
Okay, so this is again a very good question, Diksha. In modern medication, you know, they always suggest that, okay, start with prenatal vitamins, right? So what's your take on prenatal vitamins?
I think it's a bit mindless to keep taking prenatal vitamins if you haven't been assessed for your digestion, and how your elimination is. If you're constipated and you're taking all the vitamins, they're not going to go anywhere because they are not getting eliminated properly. So, first, you need to get that assessment right. And then you start taking those. And my advice is to work with both. You should go to a nutritionist, and you should also go to a natural practitioner, so that you can work with both of them holistically. It's best if somebody does all of that together, but otherwise, get yourself assessed first. Don't just start using all the folates and everything, and your digestion may not be good yet. So you will not be getting the benefit of all those prenatal.
Yeah, and see, taking like whenever you take any product, you know, whether it's a supplement which is supposed to supplement your diet, right? What you have to do is you have to assess whether it's correct for you, right? Even the quality of the products, you know, prenatals, I've seen people take the cheapest they can buy and they're not absorbing, right? B12, you know, you're taking the cheapest, folic acid, you're taking the cheapest, but you're not even absorbing that form of folic acid that you bought, right? So it's
I
not really
always
good.
say, I
Yeah,
always say, sorry to cut you, is
yeah,
that the cheaper it is, the worse it is. So if you
yeah,
want to get any supplements, you want to get the most expensive one, because only then and even then you still need to have your digestion working very well. Otherwise, that best one will not even work. But cheap
yeah,
one, definitely no.
yeah. So really, you know, focus on your diet, focus on your lifestyle, and you know, that's so. Any other words before we end the talk?
Any other
Any,
word?
yeah, any thoughts, any words?
Yeah, sure. My few good things which I will say, for people to take away is, one is that reach out to a practitioner, not necessarily to me or to you, to reach out to somebody who is trained in herbal medicine, who is trained in natural medicine, trained in Ayurvedic medicine. Your doctor is not trained in Ayurvedic medicine. They cannot give you advice on herbs. So reach out to those practitioners and therapists who are used to doing this work. Secondly, that start preparing from inside out. Give yourself plenty of time. If age is not a factor here, under 35 you can easily give yourself much longer time. For both men and women, start preparing well in advance and prepare from here first.
Yeah. Yeah, no, that's a fantastic advice. No, prepare from inside out. And that's the most important thing. And really, you know, take time to think about why you want to do this. I have already put the link here. You know, I'm going to, so I have already posted the link right here. So if you can see it on the screen as well, it's ashishveda.uk, right?
Yeah.
So the website link is right here. So look for this link. You can just type it, or you can look in the comment section and you will find it as well. Thank you so much, Dr. Ashish. It was a true pleasure, you know, and an honor having you here. It was really informative. I'm so sure that everyone learned a lot. We had lots of good questions. So there was lots of, you know, interaction. People learned a lot of new things. So thank you so much.
You're welcome. Thank you. I'm always glad to talk about fertility. I mean, we can talk much more about this. It's such a huge topic and so much needed, because
Yeah.
I know that men, women, and couples are suffering because they don't know what else to do. So great for having me here. Thank you so much for inviting me.
Thank you. Bye.
Thank you. Bye bye.